Hello everyone, I'm Dr. Sivarajan Tandishwaran from Kaveri Hospital, Chennai. So on February 13th, we are going to celebrate International Epilepsy Day. And part of this, we are trying to create awareness among public on how to deal with epilepsy, to increase your knowledge on epilepsy and making sure the stigma behind epilepsy is totally wiped out. So I'm going to talk about, as a sibling, meaning a brother or sister, if you have somebody with epilepsy, how are you going to deal with it? How are you going to help them manage the epilepsy? Some of my colleagues are going to talk on different topics like parents and how to manage it if you're a caregiver and so on. So as a sibling, especially a brother or sister, if somebody anybody in your family has epilepsy, obviously there's going to be a little bit of sympathy, concern, and also a bit of anxiety probably for you as well. But the key is we should make sure we are sensitive to them and give them adequate support, but at the same time we should not be too patronizing. We should make sure we're not overbossing on them, making sure we do not make them feel like they have certain particular disease. I'm sure we all do that, but sometimes we may do it subconsciously to kind of express our anxiety on top of it. So that's one key point. So the other key point is, as a sibling, we should make sure we try and help them in encouraging to take the medicines on time on a daily basis if they're on treatment, and making sure they review appointments are followed up on time, and if they have booked for any tests, we should encourage them to go on and do it and get things done at the right time. You may have a sibling who's at school or college, or you may be in your 40s, 50s, or 60s, and at any stage of life you will have a role to play in supporting them to have a completely normal life despite having epilepsy. So if you have a brother or sister who are in school, obviously making sure the school friends don't look at them in a different way, making sure the school teachers are aware of epilepsy, and they should know what to do if somebody has a seizure in the classroom or in the playground. Same at workplace, we all support the human resource department to know what epilepsy is and how to manage it if somebody has a seizure in the workplace. And there are a lot of material available in the web on what to do when somebody has a seizure, especially as a first aid. And most often any seizure would not last more than a couple of minutes, and during the time we would encourage anybody to stay calm, be with them until the fit is over, and do not try to restrain them, and make sure any harmful objects like chair, table, or anything is moved away from them. Just let them lie on the floor or on a sofa if you have a place where they can be safe. Try not to pin them on a chair, and try not to hold them, especially neck, shoulders, or arms and legs. I've had patients who have been restrained in the back of a car, and when they violently jerk, they can hurt their bones and even dislocate and break and end up in fractures. So let them be free, let them have the seizure, and don't try to put your fingers inside the mouth to stop them clenching the teeth. Don't make any attempt to put some clothes inside to prevent the tongue getting bitten. Despite tongue getting bitten, it does not come to any major harm, and you should not put any objects in the mouth. And when the fit is over, most of us will notice that they are very drowsy, sleepy, and they may sometimes vomit. It's better to put them in a left lateral position, so whatever vomit comes out, it comes to the floor and not regurgitated or aspirated into their mouth. So you should not make them lie upright. You should make them lie on the side, so whatever comes out of the mouth goes to the floor. That's very, very important. And do not bring liquids or chocolate or things to sort of increase the sugars and try to put them in the mouth, because they can simply get into the throat and choke them. So wait out, and if the person is well known to have seizures, they will slowly come around and they will be fine in half an hour, 1 hour's time. In elderly, it may take several hours to come around to normal self. You should call for an ambulance only if the seizure is repetitive or lasting more than 5 minutes, or if it is different in nature or character than the usual epilepsy. And when you are in a public place, try to be sensitive to those who are having a seizure, and make sure the onlookers are asked to move away, and stay calm, stay with them until the fit is over, and then we can deal with it. So as a sibling, it also carries a bit of anxiety whether you may also develop epilepsy. I mean, epilepsy is not something that is contractable or does not spread, and it is not hereditary. So you don't need to worry in that angle as well. So I hope this message gives a little bit of insight into caring about epilepsy in emergencies and also in routine life. So hope to see you all in the next video. Thank you.